Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hi, everyone. Welcome to another episode of AMG Vitality Vault Podcast. I am Dr. B, and we have the famous Dr. G over here, famous for his sockwear, right?
What? So today I am rocking paying homage to the phone booth in England, those classic red phone booths. Mm-hmm. We don't see many phone booths around, do we?
No, I don't think they're existent anymore.
They have gone the way of the dinosaur. But you know what's not going the way of the dinosaur? Diabetes.
Oh.
I mean, with the way we play this game, we're playing a losing game here because it's just getting more and more difficult to treat and easier to get. I mean, it's exploding.
I know. It's crazy. So today we'll be looking at common medications that we use in managing type 2 diabetes. And we're looking at their usage and side effects, mechanism of action, side effects, okay? So understanding type 2 diabetes management, I mean, we have to have a better handle on diabetes.
Yes.
And it's not one fit all. We definitely want to practice personalized medicine and personalize a treatment plan towards you. We want to address medications that help with insulin resistance, helps with secretion of insulin, enhancing that, and ultimately glucose control. And so we were going to talk about how these medications work and side effects, because side effects can help if you know what to look out for. That can help you to manage symptoms when it comes along and talk to your doctor or healthcare provider about changing that if you're having those side effects. And also some side effects are more common with different conditions. Or if added to other medications that may have similar side effects can increase the chances. So again, when your doctor talks about adding a medication to help with your blood sugar control, we want to make sure that it's the best one for you and decreases the chances of side effects when using that particular medication that doesn't have any contraindication with other medications in your cabinet, and that it will give you the best outcome with lowering the blood sugars.
Let's start off with metformin, right? An oldie, but a goodie. I know a lot of people still love using this one. It is still pretty much the go-to to first and the first line treatment for patients who have type 2 diabetes. It is in the class of biguanides, and these just reduce the way your liver makes sugar. So your liver does make sugar through a process where it breaks down the glycogen stores that are there. Glycogen is a molecule that is basically a large form of sugar. So that's what it does. Common side effects of metformin are GI upset. Most people have nausea or even loose bowels. And very rare, we haven't seen it much, is lactic acidosis. And other known side effects of metformin are B12 deficiency, which is because of how the medication works. But it's an oldie but a goodie. People still use it. And I know there's talk of it being in the longevity medicine space, but we're still waiting to see more and more data to that effect.
Next up, we have the sulfonylureas. These are like your G drugs, glimepiride, glyburide, glipizide. And what they do, they actually help to increase the insulin secretion from your pancreas. So it helps to boost your own natural insulin secretion. And so it goes towards these beta cells in the pancreas, and those are the ones that secrete insulin, and it stimulates them. So because it helps to increase our natural secretion, it can actually lead to hypoglycemia. That's one of the more common side effects. So if you're on one of these medications and you're not eating as frequently as you should, can definitely help drop your blood sugars because it increases insulin. Another side effect could possibly be weight gain. Because insulin, typically, it is what we call a anabolic hormone. And it also increases, unfortunately, stimulates your appetite as well, too, so it can lead to weight gain. And some other cardiovascular risk factors associated with sulfonylureas, especially if you're at risk for that already. But typically, I don't see a lot of these medications used a whole lot anymore. Sometimes I see them being added, but it's not one that we typically prescribe as well to, just because of some of the possible side effects. But with everything, you always weigh your risk and benefit. So if you need something, maybe even just transiently to help to lower the blood sugar until we can get you back on a healthy streak again, or get you on a different medication, whatever the case may be, this may be a good choice for you.
Then we have the TZDs, so thiazolidinediones. These also enhance insulin sensitivity. So common names are pioglitazone, rosiglitazone, and pioglitazone is actually called Actos by patients. And this one, it works by activating the PPAR gamma to improve sensitivity of insulin in your fat tissues and your muscles and your liver. So this is a good class to be on. Oral medication, dosed typically once a day. You can see some weight gain, and you can also see some swelling in the feet. So people who have a history of heart failure, we are very careful with this one. It can definitely exacerbate that condition. There is also a very rare risk of bladder cancer for anyone on Actos. It's extremely rare, but it's worth noting, so that way you know and we empower you. And even with the Actos, there is also a risk of hypoglycemia. It wasn't there, but you can see that. But that's typically when it's married to like an insulin or another medication that can cause hypoglycemia. So watch out for that. So oldie, but a goodie. Oral medication.
All right. Next up on the list is the DPP-4 inhibitors. These enhance incretin hormones. That's responsible. These incretin hormones help with glucose metabolism in the gut. Examples of these medications are sitagliptin, saxagliptin. So these gliptins, or other. So brand names would be Januvia. Is a more popular one.
Yes.
And so there's a DPP-4 enzyme that these medications inhibit. And so in doing so, it increases incretin levels. And these incretin levels, as I said before, helps to, with insulin sensitivity, helps to increase insulin secretion and reduces the glucagon in that liver. So side effects of these medications can include joint pains and, in rare cases, pancreatitis. So just things to look out for. Also can cause some swelling, the peripheral edema, and can increase your chances of heart failure. So again, weighing the risk and benefits of these medications, and if you need them to help lower your blood glucose levels, just look out for any signs of these possible side effects.
And a key thing to note that with the DPP-4s, they actually help to boost GLP-1 activity. So because of how they inhibit the DPP-4 enzyme, which breaks down natural GLP-1. So look at that. GLP-1. Oh my gosh. Hashtag segues on deck. So the GLP-1s, everyone knows them. We all love them. The newest kids on the block, one of the newest kids on the block with regards to treating the disease of diabetes. They are the receptor agonists, multifunctional. They do many things, whether it be cognitive health. They help with gut health. They also help, obviously, most importantly, with controlling blood sugar. Examples are liraglutide, exenatide, and everyone knows semaglutide, and then the newer ones like the Mounjaros, which is tirzepatide. So, I mean, there's a list of tides out there. The tide's coming in, so catch that wave. The mechanism of action, so they mimic your natural GLP-1 hormone and enhance insulin. They inhibit glucagon breakdown, and they slow gastric emptying. I think that's a big one that most people benefit from, is feeling fuller longer. Because the foods we eat nowadays, they are engineered to be quick in, quick out. And that way people are getting hungry right after. And that's pretty much because of how your body processes these foods. Now, some side effects of this class can be like nausea. You can sometimes see vomiting. You can even see diarrhea and constipation with this class. There is a risk of pancreatitis, and you can sometimes see increased heart rate. There is also the talk of people having sometimes kidney issues while they're on this. And that is typically because when you slow down gastric emptying, these drugs also help reduce, increase satiety. So you feel fuller longer, and it also takes away the thirst mechanism in some people, or reduces that, so you don't drink enough fluid. And that's typically where the kidney issues come in. So if you're on these medications, you want to make sure you are drinking enough or staying very well hydrated and making a concerted effort to hydrate yourself while on these drugs.
All right, SGLT2, that is inhibitors. These are medications like the, let's see if I can say these words now. Nice. Empagliflozin.
There we go.
And another flows in.
It all flows in, all right? It all flows in nicely.
These are well known as Jardiance and Farxiga. There were a couple others that's probably not on the
Invokana was one too.
Invokana was there before. But the two most common ones are Jardiance and Farxiga. And the mechanism of action of the SGLT2 inhibitors to actually inhibit glucose reabsorption in the kidneys. So they work on the level of the kidneys. And the kidneys are responsible for reabsorbing certain salts and sugars and electrolytes, glucose being one of them. So they increase the actual excretion of the glucose into the kidneys and prevent them from taking it up. So yes, you pee out more sugar.
So it's literally sweet pea.
And because of that, it does increase your chances of urine infections and other genital infections. So if you're already prone to recurrent UTIs, this may not be the best drug of choice for you because it also, causes more excretion of glucose. And with any kind of dissolute, the water follows. So basically, as the kidneys pushing out more glucose, is pushing out more water, so it can cause some dehydration and hypotension or low blood pressure because of that. So you want to make sure that you stay hydrated. So staying hydrated is definitely going to help to make sure you're not becoming volume depleted, and also help to reduce those chances of UTIs as well too, because your urine is going to be more dilute. So hydration is key. There's also a risk of ketoacidosis and increased incidence of fractures and some amputations in these classes of medications. Rare, but there were those associations.
Now, the alpha-glucosidase inhibitors. So we don't use many of these anymore, but I mean, it's worth mentioning because you do come across one or two patients who are actually well controlled on this class of drug. And the most common one that we know of is acarbose. And what these do is they help with excreting extra sugar. So basically they manage postprandial spikes in your blood sugar, right? So they delay the carbohydrate digestion. So basically, once the carbs hit your gut, because of these drugs, you don't absorb them, and you just pass them out. Now, the side effects, husbands love them, wives hate them, flatulence. So you got to be very, very careful with this one, with the gas that you produce while you are on these medications. They do work well, though.
All right, and let's talk about the big guy, insulin. Yes. I mean, it's the one that's responsible for this disease state in the first place, because it's when your pancreas production of insulin decreases, that's when your, you're having your blood sugars are out of control. Now, insulin tends not to be the first class medication when you're diagnosed with diabetes type 2, unless it's really advanced at the stage of diagnosis. So let's say your A1C is over 10. That means that your blood sugars are running in the 300s or 400s, consistently. So sometimes you start you on insulin to bring that number down, and then maybe transition you to another medication. And other places you typically see insulin being prescribed is after being on at least 3 of the other agents and it's not getting you to a goal A1C, then we want to add something on or, reduce what you're taking and move you to insulin. Insulin is what it is. It's basically replacing the insulin that your body is missing. It lowers your blood glucose by acting on your insulin receptors in the cells, and they take up pick up the glucose and utilize it effectively. Side effects, of course, if you're not eating frequently or what you should be eating, it can actually increase your chance of hypoglycemic episodes. So if you're started on insulin and you have episodes where you're feeling like shaky, fatigued, just don't feel right, you might want to check your blood sugar levels, do a finger stick and see what your levels are. And it depends on, whether you're running in high numbers or low. It depends. Some people can get hypoglycemic at even a blood glucose of 100. Doesn't necessarily have to be very low, but you want to look out for that and maybe have a little bit of something sweet, not too much to overshoot it. So other side effects of insulin, going back to the slide there, weight gain is a side effect of insulin, and fluid retention as well too. You just want to look out for that, and it's always balancing the medications and your what you're taking in, your diet, activity as well too is going to help, because increased cardio activity helps with glucose metabolism. But we typically save the insulin for the last resort, or when we really have someone who, let's say in the hospital, if you come in and you're in diabetic ketoacidosis, there's nothing that's going to lower your blood sugar as effectively right away as insulin. And insulin comes in different forms. We have long-acting insulin. We have intermediate and short-acting. So, it depends on what you need. If you need little boluses of short-acting when you eat, if you just need that one basal long-acting insulin. So your healthcare provider would work with you and determine which one is needed. And insulin typically is still the first-line drug in type 1 diabetes, but we're talking about type 2 diabetes here in this episode.
So key takeaways. We want to make sure that we are targeting the blood sugar. We're making sure that what I put you on helps to get you where you need to be. Be very wary and aware, of the side effects that could happen with each medication that you are taking as a consumer. Talk to your doctors. Always get an idea as to what should you be expecting. And obviously, when you sit down with your doc, it's not a cookie cutter approach. It's what works best for you in your lifestyle, and kind of figuring out, what else do I need to change, doc? I always tell people, always ask me, am I going to be on this forever? And for sometimes it's a no. And I'm happy to say no. You don't have to be on some of these medications forever, as long as you make the necessary changes lifestyle-wise to help your body heal, to help your body, to help yourself adjust to your new reality. But for some patients, sadly, if they don't make that connection, in their heads about, okay, I'm going to make the effort to make these changes, to give up my soda drinking, to give up all these habits that I have that are fueling this raging fire of diabetes, then I'm going to relegate myself to be stuck on medications. So it's for the vast majority of patients that we see, it's a choice. It's a choice that you have to make. Do I want to keep living like this? And if not, what can I do to help heal and help to improve my chances of longevity? Because like I say, every medication has side effects. You have to live with them, and we have to deal with them.
But we're here to help you.
We are.
Help you achieve your health goals and help to answer any questions that you may have. So if there are further follow-up questions, please remember that you can email those questions to us at the amgvitalityvault@gmail.com.
Send us your emails.
Yeah, absolutely. And we'll make a list of them. We'll answer them here in the podcast.
Answer them on the podcast.
All right. It was great talking to you guys today. Hopefully you learned quite a bit today. And Dr. G, anything else?
No, just stay empowered, keep learning, keep growing. And we can't wait to get you guys back in the vault again where we dive into another cool health topic. Take care, guys.
Bye.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.